thanks for joining me for this week's Movement in Anatomy, where we're going to be addressing the muscles in the legs and how they move in our bodies. We'll be integrating some exercises just to see how they feel in our bodies and if we can identify some of these major muscles in our legs. So I do have a block today for some of our exercises, but you could use a pillow, firm pillow, or a folded up pillow, or you could even use a stack of books. Just something that we're going to be placing it underneath our sacrum when we're lying on our back. So we want a little bit of elevation. So let's look at some of the actions involved in moving our legs. The first action we're going to look at is extension and flexion of the thigh. Extension is where we draw the thigh back, and flexion is where we draw the thigh forward. So when we draw the thigh back and extend the thigh, we're using the muscles on the back side of our posterior side of the body. We have gluteus maximus, we have biceps femoris, semimembranosus, semitendinosus, and we even have a little bit of adductor magnus helping out there. When we draw the thigh forward in flexion, we have muscles on the anterior side of the thigh working. We have rectus femoris, we have sartorius, we have iliopsoas, we have tensor fasciae lata, we have adductor longus and adductor magnus also helping out. So the next action that we're going to look at is lateral rotation and medial rotation of the thigh. So lateral rotation of the thigh is that thigh bone rotating outward. And medial rotation is where the thigh bone rotates back in towards the midline. So the muscles involved in that lateral rotation, as we turn the thigh outward, are gluteus maximus, gluteus medius, and our piriformis. We also have sartorius and iliopsoas involved, and quadriceps femoris. Medial rotation, where we draw the thigh bone back to the midline, is our gluteus medius. The next set of actions we're going to look at are abduction, abduction, and adduction. Abduction is where we take the leg out laterally towards the side, and adduction is where we bring it back in towards the midline. So as we extend the leg out towards the side in abduction, we have these muscles, gluteus maximus, tensor fasciae lata, piriformis, and sartorius engaged in that action of extension. And as we draw the leg in, adduction, we have our adductors working, adductor magnus, adductor longus, gracilis, as well as quadriceps femoris. The next action that we're going to look at is flexion and extension of the knee. So flexion and extension of the knee can be just flexing through the knee joint and drawing the heel towards the glute. It could also be involved with flexion of the thigh and flexion of the knee. And then we have extension of the knee, which would be just lengthening and straightening through the knee joint. And if we had flexion through the thigh and extension through the knee, we would press the heel out, elongating right through the knee joint. So the muscles involved in that flexion of the knee joint are going to be the muscles on the back side of our posterior side of the leg or thigh. So we have our biceps femoris, our semimembranosus, our semitendinosus, we have gastrocnemius, and we even have sartorius involved in that flexion of the knee joint. The extension of the knee joint are going to have muscles involved on the anterior part of the thigh, our rectus femoris, our vastus medialis, and our vastus lateralis, and our vastus intermedius. So the next action we're going to look at is plantar flexion and dorsiflexion. Plantar flexion is where we raise the heels, pointing through the toes, right? So we can lift the heels here, or we can point through the toes, extend the thigh, or flex the thigh and point through the toe, plantar flexion. I think it's a little easier to feel it as we lift the heels. We feel the posterior side of the leg working, the gastrocnemius, the soleus, and the fibularis longus. Dorsiflexion is where we draw the toes towards the ceiling. And we have the muscles on the anterior part of the leg engaged. Tibialis anterior, extensor hallucis longus, and extensor digitorum longus. And then the last set of actions that we're going to look at are eversion and inversion. So our eversion is pinky side of the toe, or external side of the foot, reaching up towards the sky. And our inversion is big toe towards the sky, or interior side of the foot reaching up towards the sky. Muscles involved in eversion are going to be fibularis longus. Muscles involved in inversion of the foot are going to be tibialis anterior and extensor hallucis longus. And so one last movement, which is flexion of the trunk, involving iliopsoas. We already talked about iliopsoas flexing the thigh towards the trunk, but it also flexes the trunk towards the thigh. This is a really important, often overlooked muscle that is often tight, it's often weak, it doesn't get a lot of strengthening from our everyday activities, from sitting down, driving, or studying, and even walking. It doesn't strengthen or lengthen. So I want to take this time to do a little bit of exercises for our iliopsoas. So we're going to grab our block and we're going to make our way down towards the floor. All the way onto your back. Lying down. So again, you could use a pillow, you could use a stack of books. And if you're feeling any pain in your low back, just remove the block or your books or whatever you have underneath you. You're going to place this right underneath the sacrum. You want it right on that flat part. You want the hips to be supported, the pelvis to be supported. So I have mine quite high. It doesn't need to be high, although the higher you are, the more of a stretch you're going to feel. But again, it really depends on your body. If being this high doesn't feel good, take it down a notch. With the block underneath the sacrum, we're going to lift the feet off the floor and balance on your block or your books. Just finding that balance first. So the knees are over the hips. And you can think of drawing that belly, your belly muscles, kind of towards the front of your spine. Just take a moment just to notice what's working in this pose. What muscles are activated? You should feel that your core muscles in the front are working to help support this flexion of the thigh, right? So already we have this flexion of the thigh, which our iliopsoas is already working, as well as some of our deeper, core muscles right through the front. So we're going to extend the right leg and draw the left knee in towards your chest. Just hug your left knee and extend the right leg to the hover. Really point through, we'll just start with pointing. Point through the right foot. Pull the belly down towards the front of your spine. Maybe even squeeze the glutes slightly. Think of drawing the inner thighs towards the middle, right to this midline. Like if you were to draw a line all the way through the center of your body, that we really want these inner thighs to be hugging towards the midline. So we're going to lift the right leg up towards the sky and then lower it towards that hover. And you're just going to breathe. Inhale and exhale. So you're making the breath as long as the movement. So I don't want you to be moving the leg really fast, but really slow and controlled, and that your breath is slow and controlled as well. And I want you to think for a moment, what is working? We're having to stabilize the pelvis while it's being balanced on your surface. And you have these, I want you to get these outer thigh muscles pulling in towards the hip socket, that they're stabilizing the thigh bone. And the navel, all these belly muscles are stabilizing the pelvis, so the pelvis isn't rocking back and forth. We're going to again hold that right leg at the hover. Just point through the toe, try to get really long from the crown of the head all the way out. Try not to sink the pelvis. We want to keep the pelvis in neutral. And we're really activating here that iliopsoas. We're strengthening it as well as lengthening it, particularly now as we drop the right heel down to the floor and press the heel and the thigh towards the floor. And then maybe hug that left thigh towards the chest even more. So you should be able to feel this stretch on the front of the thigh, right? The muscles right on the front of the thigh and deep into the belly. This is a really great stretch to do from all of our sitting that we do. When we're in that thigh flexion, those muscles get a little bit just weak and tight from lack of use. And so we really want to be able to stretch out these muscles, particularly iliopsoas, and lengthen the muscle. And as we lift the leg up and down, it begins to strengthen it at the same time. So let's do the other side. We'll draw the right knee into the chest and extend the left leg, point through the toe. Notice now how the different sides feel. Pull the belly, right? Pull all those belly muscles down towards the floor, towards the front of your spine, supporting your pelvis. We want to find that stability. You're turning on, right? You're activating all these muscles in the front of the thigh, right? Our rectus femoris and our sartorius. We want these muscles engaged. We're going to slowly lift the leg up and lower it down, connecting the breath to your movement. Inhaling and exhaling. Really see if you can feel the muscles stretching, right? Engaging and elongating. You can hug that right knee in towards your chest a little bit more. And you'll feel the tension on the opposite leg. We're going to lower that left heel all the way down to the floor here. Lengthen through the front of the thigh. Press the heel down. Hug the thigh muscle to the thigh bone as we draw the thigh bone towards the floor. Notice where you're feeling the stretch. And then we'll release it. Draw both knees back in towards your chest. And then just hugging the thighs with your hands. Just see how much you can straighten your legs. Maybe they stay bent. Maybe you can straighten them all the way. Just notice what muscles are being used to hold your legs up. Maybe your legs are shaking. And that's okay. We just notice where we are in our bodies. And then we'll rest the feet back down. Remove your support underneath you. Relax the pelvis back down to the floor. And then lengthen the legs out. And just take a moment to feel the thighs, fronts of the thighs on the ground. And that's it for today. I hope that you take these stretches into your everyday life. It's super important to stretch out that iliopsoas. Stretch it and strengthen it.